Take it up this question in two separate subheadings. One is a dementia patient who is like mild to moderate degree, wherein he can do all his activities himself, number one, and most of his activities he can do by himself. Only thing is he needs support or assistance while he goes out. Okay, so in these type of patients, definitely staying in practicing strict isolation measures, taking medications on time, having a good diet and hygiene is most important. So I think this will solve their most of the problem. So luckily we have a good lot of patients who belong to this category, so that our burden on healthcare givers is lesser. Coming to the later part of your question, patients with severe dementia who need caregivers support. There are two problems with caregivers. Number one, caregivers can themselves be a carrier of COVID-19, and they themselves can be a bigger risk for this type of patient. So we generally tell the patient relatives that unless patient is too sick or moribund, generally we encourage only family members to take care of these patients. But especially in severe dementia or severe cases wherein their personal hygiene itself takes a task, then yes, definitely we suggest the caregivers to practice strict hand hygiene and strict hygiene precautions, and do aggressive physiotherapy, because the breathing pattern usually they will have a lot of aspiration, they will have a lot of hypostatic pneumonia, so wherein that itself can trigger the risk of COVID. And keep the room well ventilated, and especially if there are any family members who have a risk of COVID, or if there is a exposure or primary contact or secondary contact, please avoid. Sometimes actually I tell the family members that don't visit your parents. Sometimes they stay in the same apartment in a different tower. So suppose if somebody has a risk of COVID, we just tell them, okay, fine, you just monitor them either by video call or something, just supply their essentials, and don't enter there. Because most of the dementia patients who had COVID and who were admitted with me, absolutely there is no history of travel. Last 6 months, 8 months, they have not even come out of their house actually. So you can interpret this in this way, that either the other family members who have gone out, they have given the infection to them, or the caregiver who comes to the house regularly to clean or help the patient, so they give the infection. So yes, your question is very valid. Definitely there is a increased risk. So I urge all the audience, especially if you have any elderly at home who are frail, who need support regularly, please do not be overconfident. Please think about them. Please help them whatever you can, but never socialize with them. And especially don't allow your kids to play all the time with them, because in first wave, kids were they were asymptomatic carriers of the infection. So they go out, they play, they come back home and give the infection. They may be, even if you do COVID, they'll be negative, but the whole house, the whole family gets infected with COVID. So my message is that.